And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. This is Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative, and a lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free at 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. Well, I want to talk about arthritis and osteopenia and osteoporosis and low back problems, sciatica, back pain, restless leg syndrome, degenerative disc disease, joint replacement, all that kind of stuff, because the medical system has approached this entirely 180 degrees incorrectly. Even the New England Journal of Medicine, big Harvard study, said in 2002, came out and said, oops, knee surgery is what they said. Knee surgery for arthritis is absolutely worthless. That's Harvard Medical School, published in the New England Journal of Medicine in July of 2002. Surgery for arthritis, knee surgery for arthritis, is a worthless procedure, yet it's still the bread and butter surgery for orthopedic surgeons. Then 4 years later, in the Journal of the American Medical Association, big headlines, low back surgery worthless for sciatica, low back pain, degenerative disc disease, restless leg syndrome. And so why do doctors still do this? Why do they lie to their patients and say, oh, listen, there's no way you can regrow disc. Those quacks, there's no way you can regrow cartilage. When the pain medicines don't work anymore, the only thing for you is joint replacement surgery or back surgery. We got to take out what's left of your disc, your bulging and your ruptured disc, and we got to put in some mechanical device or fuse your vertebrae together. Well, give me 60 days. This is Dr. Joel Wallach. Remember, I'm a veterinarian and a physician. And in veterinary medicine, we don't have personal insurance for animals or government insurance for animals. And so when a pig has double knee replacement requirements, right, when if an orthopedic surgeon for humans would say, oh, that pig has bone-to-bone arthritis in both of his knees or both of his hips, he needs double joint replacement, he becomes bacon because there is no money for a stupid thing like that. So we learned a long time ago, even rheumatoid arthritis we learned 60 years ago was a simple infection with a bug called mycoplasma. And we learned how to get rid of rheumatoid arthritis. I mean, get rid of it, right? In animals 60 years ago. Very simple disease to get rid of. 85% of animals and people with rheumatoid arthritis get osteoarthritis at the same time. So what I do is I use the approach for animals, and I deal with infection as well as the degenerative arthritis or osteoarthritis in the same person. And guess what? When you approach it from that way, you get remarkable beneficial results. We can support and promote healthy maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae and bone matrix, bone itself. Contact your Youngevity associate and say, what is Dr. Wallach ranting and raving about? That we already know how to support and promote maintenance repair of cartilage and ligaments and tendons and connective tissue and disc between the vertebrae, bone matrix, and bone itself, using little nutritional programs. That is correct. And so what I want you to do is contact your Youngevity associate. If you have arthritis, if you have bone-to-bone arthritis, if you have low back pain, if you have sciatica, if you have restless leg syndrome, if you have osteopenia or osteoporosis, bone spurs, bone calcium deposits, you have any of that kind of stuff, what I want you to do is contact your Youngevity associate. Okay, Dr. Wallach says give you guys 60 to 90 days. Yeah, give us 60 to 90 days. You can always get the surgery, right? If we fail you and cannot meet your requirements for, let's say your goal is to get rid of your joint pain and increase your joint range of motion, stop all the crazy popping and clicking as you go up and down the stairs, what if we can do that in 60 days? Why on earth would you want to get joint replacement surgery in your knees, your hips? Why would you want to get back surgery? You see, You can always get the surgery, but you can't always get unsurgery, uninfected, unparalyzed, and undead. This is what these articles are saying. Remember, JAMA, the Journal of the American Medical Association, we're talking about 2006, said, back surgery for sciatica and all this other things associated with it, like low back pain, hip pain, peripheral neuropathies, numbness, burning in the feet, restless leg syndrome, degenerative disc disease. Why would you want to have surgery when you can solve the problem with a nutritional supplement program? Same thing with knee replacement or hip replacement surgery for bone-to-bone arthritis. Why on earth would you want to risk the surgery without first giving it the non-destructive, non-surgical, non-dangerous thing first, non-invasive stuff first? Give me 60 to 90 days, and let me give you a program that's totally nutritional. We will give you the nutritional program that will support and promote healthy maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And if you're, we have all kinds. We can even do it for vegetarians. We even have programs for vegetarians where you can do it for vegetarians. I don't care what your eating habits are. If you're allergic to this or that or the other, we can make it happen. It's amazing what we've learned how to do. Give me 60 to 90 days. You can always get the surgery if I fail you. It just, cost you a couple of bucks a day. Truly, depending on your body weight, anywhere from $2 to $5 a day, $2 a day for somebody 130 to 150 pounds. For 150 to 200 pounds, it might cost you $5 a day, for say 90 days, and we'll cut that by 30% off for maintenance. These nutrients are required every day, every minute of the day, just like oxygen and water. The reason why you have problems is not because you don't have a good surgeon, it's because you don't have the nutrients. So give me 60, 90 days. You can always get the surgery. But remember, you cannot get unsurgery, uninfected, unparalyzed, and undead. Contact your Youngevity associate today and say, okay, let's test Dr. Wallach out here and see if he's just spitting in the wind or if he can really do something. We'll be back with Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity. And if you want to find out if I have a big mouth, just with nothing really to say, just ranting and raving for nothing, or if I really have something going here, contact your Youngevity associate and ask for that CD, Dead Doctors Don't Lie. Ask for the book, Dead Doctors Don't Lie. And then ask for the program to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between a vertebrae, bone matrix, and bone itself. Give me 60 to 90 days to deal with your osteopenia, your osteoarthritis, your osteoporosis, your low back problems, your sciatica, your restless leg syndrome, your peripheral neuropathies, burning, numbness in the feet. You can always get the surgery, but you can't always get unsurgery, uninfected, unparalyzed, and undead. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk about medication errors as we've got a study out. And this study was done by a Urmimala Sarkar, a medical doctor at the University of California in San Francisco. And the headline of this article says, doctor's office is usually the first stop in medication mishaps. They say that 4.5 million people go to the doctor's office or the ER every year due to some adverse reaction to drugs or an allergic reaction or toxicity. And they say that up until now, most of the research had been focused on these errors that happen in hospital settings. But according to the lead author here, she says that 80% of medical care actually takes place in the doctor's office. So she said you would expect a real burden of the problem to be there. They analyzed data from 2005 to 2007 from the National Center for Health Statistics and found that 13.5 million outpatient visits during that 3-year period had links to negative effects from prescription medications. This was all published in the journal Health Services Research. The patients made nearly 3/4 of the visits, 72% to doctors' offices, 28% went straight to the ER. And they say it was more common with the elderly, as most of these people were 65 and older. However,
Wait a minute. Am I elderly?
Well, that's what they said. I'm not saying that's their words, Doc, not mine. Okay. Clear that right up. Mm-hmm. Yeah, and they go on to say, more important than age was the number of medications taken, because according to the lead author here, Sarkar, she says that it isn't just a problem for older people. There were very significant numbers of adverse drug events in middle-aged people as well. And they say that this multiple medications, or as you like to call it, polypharmacy, was the most critical factor. Study found that medication-associated problems represented a substantial burden on the healthcare system. And beyond the cost of the initial visit, 22% of the patients were scheduled for follow-up visits and 9% were admitted to the hospital. And another doctor that they interviewed for this article, a J. Lyle Bootman, Ph.D. and Dean of the College of Pharmacy at the University of Arizona, says, as imposing as these figures are, undoubtedly they are underestimating the extent of the problem. Says an older woman might be treated for a broken arm, for example, without anyone reporting that dizziness by medication is what led her to fall. Said a broader view would include harm that occurs when drugs are ineffective or prescribed or not taken at all. So another big black mark on the medical system because all these drugs they put out all the time.
Exactly right. And another figure from 2006 is that 1.5 million Americans are killed and injured each year. 1.5 million are killed and injured each year. That's from the Center for Disease Control. And let me tell you, and that what they said was from just prescription mistakes. Now, that's not the side effects of the drugs. And that's what I'm assuming this doctor is talking about. This is not from the side effects of the drugs. This is from prescription mistakes, where the writer of the prescription screwed up somehow with a decimal point or mixing drugs that shouldn't be used together, the polypharmacy thing, and also where the pharmacist fulfills it incorrectly because he couldn't read the writing, takes a guess at it instead of calling the doctor to clarify it. And then thirdly, the individual mixes it with other stuff or takes it with grapefruit juice or something. Or if you're a bad luck person, the doctor screws up, the pharmacist screw up, and you screw up. 1.5 million Americans are killed and injured each year from these types of prescription mistakes. And then you throw in the actual side effects of the drug. Now we're talking 15 million Americans are killed, injured, and infected each year from doctor mistakes. And people continue to go to the doctors. I just find this amazing. We rank 60th in the world now when it comes to longevity, 92nd when it comes to healthfulness. We spend more money for health care than all the 218 nations of the world put together. Man, wrong choice. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity. We do have lines open. Give us a call toll-free at 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you're going to do the Youngevity business as a business, contact your Youngevity associate and ask for the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy else. That's the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. If you do the Youngevity business as a business, you can get legitimate tax deductions for the purchase of the trilogy of books. Okay, Doug, let's go to callers.
Let's head to Michigan, and Tammy, you're on with Dr. Wallach.
Hello, Tammy, you're on the air.
Hi, how are you, Doc?
Great. How's it going?
It's going great. Very, very
good.
Thanks for asking. Yes, I'm calling just to ask about migraines. I have a good friend that suffers from them horribly, and I promised her I'd call to ask you for some help.
Okay. Migraines have to do with either food allergies and or withdrawal symptoms of caffeine or sugar. In other words, if somebody drinks a lot of caffeine, either in the form of iced tea or coffee, every hour, and then they get busy, and for 3 hours they're driving or something, and they don't have their source of their caffeine, as they're going through withdrawals, they will get this monster withdrawal headache, right? It's called a migraine headache. There's some people who are allergic to green beans or allergic to shrimp or whatever it is, and they'll get a migraine headache associated with that, or the nitrates that are in deli meats, whatever it might be. And this is something where they will find out, and I like people just to give up sugar, no sugar whatsoever, and no caffeine, and that takes care of about, 80 to 90% of the migraines. They just go away as long as you're off of sugar. It might be a little grim for a couple of days as you're going through withdrawals, but within a couple of days it's over with, right? Then they have to keep a diary if that doesn't solve it, and they'll notice, gosh, every time that I go to this particular restaurant and I eat X, it could be something like MSG. Go to a Chinese restaurant every third Friday of the month because you get paid or something. or you have a meeting with a friend at a Chinese restaurant, they put lots of MSG in the food, and you're sensitive to MSG, you get these horrible migraine headaches. You go there the next week or the next third week, and you say, I want that same dish I had last time I was here, but I don't want you to put the MSG in it. You have the dish, you don't get a migraine headache. MSG can be involved, and it's like 0.0000001% of the population of Americans are sensitive to MSG. But it's so painful, so uncomfortable for the people who do have this problem from MSG. They spend their entire life trying to get everybody else on Earth off of MSG. It's a very small part of the population, but they're very passionate because it's so uncomfortable for them. They just need to go on with their life and stay away from MSG. And so they need to get on the 90 essential nutrients, ramp up their body's defenses, and find out which is the offending food. And I always like to start them by getting off of sugar and off of caffeine, and invariably that'll get rid of 80 to 90% of migraine headaches, okay?
Okay.
Always good to talk to you, Tammy.
Thank you, Doc. Well, I really appreciate it.
Hey, bye-bye.
Bye-bye.
All right. We only have a moment here, so I'm going to go ahead and take that. I do want to tell you we do have lines open. Give us a call toll-free at 1-888-379-2552. And don't forget that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins, minerals, and trace minerals, and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity. We do have lines open. Give us a call toll-free at 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you want to live well beyond 100 chronologically, say 110, 120, 130, well, being biologically, say 30, 40, 50, 60, contact your Longevity associate and ask for Dr. Milan's my new book out, Immortality, and learn how the top 20 longevity cultures on Earth actually have 40 times the 100-year-olds we do. They have 100-year-old per 250 of their population, while Harvard Medical School says Americans have only 100-year-old per 10,000. These long-lived peoples have 40 times the 100-year-olds we do. They live to be an average of 90. We live to be an average of 75. They live 15 healthful years longer than we do. They spend almost nothing for health care. They're all third-world cultures. No doctors, no insurance, no hospitals, no clinics, no pharmacy. How do they do it? Contact your Longevity associate and ask for Immortality. Okay, Doug, let's go to callers.
Let's head to South Carolina. And Peggy, you're on with Dr. Wallach.
Hello, Peggy. You're on the air.
Yes, Dr. Wallach. I was introduced to your product. I have a daughter who's 46 years old. She's a transplant recipient of a heart and both lungs 16 years ago. And now they're saying that she needs another set of lungs. And I was wondering if you would recommend your product for her.
Okay. Well, yeah. First of all, and she had this transplant, 16 years ago, you say?
Yes, 16 years ago.
Okay, now, what does she have? Does she have cystic fibrosis? Or?
She started out with primary pulmonary hypertension.
Okay. Mm-hmm. All right. But did they do anything other than transplant her heart and her lungs? I mean, did they not change everything else she was doing?
No, she worked. She went back to work. And
working, okay, that's not quite what I'm asking.
Okay.
What I'm asking is, did she change, not what she's doing for work, but what she's doing for her health? Or did she just keep doing the same old, same old? I'm trying to figure out why 16 years later now she's having lung problems again.
Right, yeah, well, just same old, same old.
Okay. Did she smoke?
No.
Okay. All right, here we go. What does your daughter weigh?
She weighs about 117.
117, so she's a small girl.
Mm-hmm.
And how tall is she?
5'2".
Okay. All right. Well, I want her to give up all fried foods.
Okay.
I mean, nothing fried. Because they have this trans fatty acids, the free radicals, which damage tissue, your immune system, your support system, right?
Okay.
So no fried foods. It means no fried eggs, no chicken fried steak, no fried potatoes, no fried rice, no stir fry, no fried eggplant, no fried okra, no fried tomatoes, no fried chicken, fish, shrimp. I mean, nothing fried.
Okay.
I mean, ever again, because that'll do bad stuff.
Okay.
Okay. Then no processed meats with nitrates and nitrites, because the worst possible thing for your blood vessels next to fried foods is nitrates and nitrites, which you find in things like deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, canned meats, none of that stuff. Can't have any of that.
Okay.
The nitrates cause inflammation and clogging of small arteries, which contributes to primary pulmonary hypertension and so on. Okay? Cannot have those kind of things. She can have chicken, but it has to be roasted and stewed and baked.
Okay.
She can have red meat, but it has to be roasted and stewed, right?
Okay.
Can't have any margarines, nothing burnt, no salad dressings, no mayonnaise, no meat cooked well done. I mean, she's got to stay away from, she can't even go into a house where they're frying foods. All right? Now hang on here, because when we come back, I have to ask you just a couple more questions, and then I'm going to give you her supplement program after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity. And if you need to lose that 10, 20, 50, 75, 100 pounds or more, contact your Youngevity associate and ask for the book Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome. And when you buy the book Hell's Kitchen from your Youngevity associate, ask for a free copy of that CD by the same title, Hell's Kitchen. And don't forget to ask, if you need to lose that weight, don't forget to ask for the Slender FX weight management system. Add that to your Mighty 90. And you will lose weight and keep it off. You'll look good, feel good, and everybody will love you 1,000% more. Okay, Doug, let's go right back to South Carolina and Peggy. Okay, we got rid of all the bad stuff. Now, we need to have her eat animal protein at each meal. Okay, that means eggs, red meat, chicken, and fish, but not fried, not burnt, not cooked in oils. Okay, so you got to no processed meats with nitrates and nitrites, and absolutely, again, one other question here. Does she ever have anything like eczema or dermatitis?
No.
Okay, she was never diagnosed with irritable bowel syndrome or inflammatory bowel disease or celiac disease?
No.
Okay, good. All right. Then a supplement program for a 117-pound young lady goes like this. I want her to have 1 tablespoon, which is a half ounce, of her Osteo FX Plus at breakfast, and 1 tablespoon, which is a half ounce at dinner time. That'll be a total of 1 ounce a day of the Osteo FX Plus. And I want her to, that'll be 1 quart per month of the Osteo FX Plus. Then I want her to have 1 scoop of our Beyond Tangerine NutriCrystals, which is a crystallized multiple. I'll talk about that in a second. It has 130 nutrients in it, vitamins, minerals, amino acids, and 115 super juices, berries, fruits, and vegetables. 115, okay? A scoop in 4 to 6 ounces of water at breakfast, and a scoop at 4 to 6 ounces of water dinner time, or you can actually get 30 of the little pouches in a box, so it's easy to carry them around. They're sort of pre-measured already, 2 scoops in those little pouches. Either the wide mouth jar with the powder or the crystals, or the pouches, either one, for the Beyond Tangerine NutriCrystals. That'll require 1 canister per month or 1 box a month for her. Then I want her to have the EFA Pluses, which is a omega-3, 6s, and 9s in optimal amounts. I want her to take 3 twice a day, so she'll need to get 2 of those 90-count bottles of the EFA Pluses per month. So I want her to have 3 at breakfast, 3 at dinner. Then, lastly, let me back up here. I want her to take 2 other products. Number 1, I want her to take the Ultimate Daily Tablets, which are designed to support and promote healthy blood flow through blocked arteries. And when people have like PAD, peripheral artery disease, primary pulmonary hypertension, coronary artery disease, high blood pressure from kidney failure, and all that kind of stuff, I want her to take 2 of those Ultimate Daily Tablets at breakfast, 2 at lunch, 2 at dinner. That'll require 180-count bottle per month of the Ultimate Daily Tablets. And then lastly, to support her immune system, I'd like her to take 2 of our De-Stress capsules twice a day, 2 at breakfast, 2 at dinner. That'll require 1 bottle a month of the De-Stress capsules. And regardless, if she ultimately needs the second lung transplant, unless you change what you're doing, you keep doing the same old, you're going to get into trouble again, right? And that's why we have to be very aggressive in changing what she's doing, because over time here she's gotten into trouble again a second time. And so it's absolutely imperative. No gluten, no wheat, barley, rye, or oats. No gluten, no wheat, barley, rye, or oats. No fried foods. No processed meats with nitrates, nitrites. Absolutely no mayonnaise, no margarines, no cooking oils. Anything that's going to cause free radicals or trans fatty acids, heterocyclic amines, or acrylamides. And very, very important to do those things. Okay, call me every week. Let me know what's going on here. I want to know what her blood pressure is. I want to know her pulmonary function test. Anytime they run a test on her as they begin to make decisions, saying, okay, we can watch it for a while, or she's rapidly getting worse, or she's getting better. I need to know that. Give me some feedback every week, okay?
All right.
Okay, Peggy. All right, Doug, let's go to callers.
Let's head to Illinois. And Paul, you're on with Dr. Wallach.
So, Paul, you're on the air.
Thank you, Dr. Wallach. Just a couple quick questions for my wife. I was listening to it's about migraine headaches, and I listened to the previous caller. Mm-hmm. We've gotten off of the fried foods and changed our diet completely. Mm-hmm. No sugars, all of that.
Did it have any impact on the severity or frequency?
It seems to me like I don't know, because she doesn't complain, so it's hard to say. And I've been trying to get her to keep a log.
Okay.
She's 54, 5 foot tall, 115 pounds, swims every morning, laps. The only thing she does do is she takes creatinine, and I don't think that's going to hurt anything. But
no, I mean, has she found that it helps her any?
I think it must, because she does take it from time to time. Now, we're on your Mineral Toddy, your Tangy Tangerine, your Ultimate Daily 180.
Okay, good.
Probably not as much as we could be, but...
Well, at 115 pounds, I mean, again, I would have her, the Beyond Tangerine NutriCrystals, I'd have her take a scoop in the morning, a scoop at night each time, and 4 to 6 ounces of water. I'd have her take a tablespoon of the Osteo FX Plus at breakfast and dinner. That's, 1 ounce a day. I'd have her take 3 of those EFA Pluses twice a day. I'd kind of go that direction, make her blood vessels happy, and stay away from the processed meats with nitrates, nitrites. Stay away from the sugar and the caffeine. She's kind of work in that direction. And
she had
when she does have a migraine headache, the CM cream, she can actually, most people, they have it behind my right eye or, on the top of my head. She can actually apply the CM cream and to the area that is painful, and most of the time, the people get significant or total relief for about 5 to 8 hours, and by then it's usually passed. And then have her kind of pay attention, keep a log, because sometimes there's something in a food that she's eating, like, again, one of the common ones outside of sugar and caffeine is MSG, monosodium glutamate, which you find a lot in Chinese food if you eat out a lot at Chinese restaurants or have Chinese brought into the office kind of thing. It's also found in canned and boxed foods, bottled foods, so, things like vegetable soups or oriental frozen meals and that kind of stuff. And so you need to read labels and try eating a meal and put in, tell them, hey, load up on the MSG, I love it. If she gets migraine headaches, and then the next time you go get that same meal, say, I can't have MSG, don't, and leave it out, and see if she can eat the same food and not get the headache. And that's where you make your determinations.
Fruit.
Okay.
What about sugar and fruit?
Well, there's different sugars. For instance, there's some people who get migraine headaches by eating cane sugar, but they don't get migraine headaches when they eat beet sugar from sugar beets. And some people get migraine headaches from high fructose corn syrup, but they don't get migraine headaches from drinking apple juice, which is fructose. And so there's no way to predict. It's sort of like you got to keep a log, try it, and she will figure it out. You can run up tens of thousands of dollars in tests, and they still won't figure it out. So she's the one that has to keep a log, and she will figure out what it is. You got to pay attention to the time and date of everything she eats, and then the time and date of the appearance of the migraine headaches. And she'll say, every time that I go to that particular Chinese restaurant, that's when I get it. I never thought about it before, but that's when I get the migraine headache. And so she'll associate it with something, and she'll be able to solve it. But she's got to pay attention and keep a log, as you're suggesting to her. We'll be back after these messages. We're back with Dead Doctors Online, the ZBS Radio Network. Dr. Joel Wallach here for Youngevity. And I want you to ask for my newest CD out there, From Here to Immortality. It's actually a companion CD to go to along with the book Immortality. It's called From Here to Immortality. Ask your Youngevity associate for that CD, From Here to Immortality. Okay, Doug, let's go to callers.
Let's head to Elmira, New York. And Matt, you're on with Dr. Wallach.
Oh, Matt, you're on the air.
Hi, Dr. Wallach. How are you?
Fabulous. How's it going?
Good, good. I had a quick question. I'm a healthy 26-year-old male. I've been dealing with chronic asthma now for the last 24 of my 26 years. I was wondering what's your
Okay. Let me ask you one question. Well, two. How much do you weigh?
I weigh around 260 pounds. I'm 6'2".
Okay. And have you ever had skin problems like eczema, dermatitis, psoriasis, dry skin?
No, sir, I have not.
Have you ever had constipation or diarrhea?
Nope.
Any belly pain, appendix out?
No, sir.
Diverticulitis, gallbladder problems?
Nope.
Well, this is your lucky day.
I'd like to hear that.
Okay, because we can get rid of this very quickly. Asthma is a very, very, in fact, there's a very famous pastor in Atlanta. I can tell this story because he put it on film for me, right? And I deal with asthma literally thousands of times a month. It's an extremely easy disease to get rid of. I'll repeat that. Matt, this is an extremely easy disease to get rid of.
Awesome.
Okay. What do you do for a living?
I work at actually a parking garage.
Okay. Well, that's not a problem. Okay, here's what I need you to do. I need you to give up a few things. I need you to give up fried foods, anything that's going to cause free radical damage. No fried foods, no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, anything with nitrates and nitrites in it. No margarines, none of the mayonnaise and salad dressings. You've got to give all that up. You can use lemon wedges on your salad, but not any of the commercial salad dressings. You cannot make it yourself with any oils and vinegar, no oils. Then I want you to give up what's called gluten, no wheat, barley, rye, or oats. I want you to eat like an Oriental and live on rice and things like sweet potatoes and squash, millet. You can actually go to an Oriental food store and you can get noodles that are made from rice or made from buckwheat. You cannot eat chicken noodle soup. You can eat chicken rice soup or chicken vegetable soup. You can have beef vegetable soup, but not beef barley soup, because you cannot have wheat, barley, rye, or oats. Okay, you got to give those up. Drop dead, zero tolerance. And then here's the secret sauce: 260 pounds. I want you to take 3 ounces of our Osteo FX Plus a day. 1 ounce at breakfast, 1 ounce at lunch, 1 ounce at dinner. When you get down to 200 pounds, we'll be able to cut a third of that off. But right now, I need you to take 3 ounces a day, 1 ounce at breakfast, lunch, and dinner of the Osteo FX Plus. That'll require 3 quarts per month. Then these NutriCrystals of the Beyond Tangerine, I need you to take 2 at breakfast, 2 at lunch, 2 at dinner, and that could be 3 of those little pouches a day, 1 at breakfast, 1 at lunch, 1 at dinner, or 2 scoops in 8 ounces of water 3 times a day. However you do it, that'll be 3 canisters per month. And then the EFA Pluses, I want you to take 3 at breakfast, 3 at lunch, 3 at dinner. That'll require 3 90-count bottles per month. And then I want you to take the 3 EFAs 3 times a day. That'll be 2 of the 180-count bottles per month of the EFAs. So you're going to take 9 EFAs a day. That's 2 bottles of the EFAs a month. 9 EFA Pluses a day. That'll be 3 of the 90-count bottles of EFA Pluses. And watch what happens. Because this pastor in Atlanta, his daughter, 11 years old, had terrible life-threatening, was not being controlled with medical treatment. And in 2 weeks' time, following this little principle, it went away. Now, I do this thousands of times a year, hundreds of times a month. Very simple. Okay? Do these things. I want you to call me every 2 weeks and give me a progress report, because I want you to be my poster boy, okay? If you've had asthma for 24 years, you need to get this done. And you're going to save a lot of kids by giving a report on your own experience. Well, thank you, everybody. Great testimonies, great questions today. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.